Hi, my name is Kristen Schromick, and I'm recording this video to give you a brief introduction to a course that's being offered at Northwest Vista in the spring of 2024. Miss Brandy Barrera and I are going to be teaching that course as an academic cooperative and a hybrid course, which means that it's both an elective and the hybrid part means that we'll be meeting one day a week in class and the other day of the week will be online coursework. In terms of it being elective, that means it's actually a really great way for all different kinds of students to join us in this class. Despite the fact that it's a psychology course, we definitely want to invite all of our psychology major students to join us because the central part of this class is that there's a strong connection between mental and physical health. So that will definitely be a central component of what we're learning. However, there are a lot of opportunities for other types of majors to learn lots from the course as well, because not only are we interested in the mind-body connection in terms of like mental health, the physical health component is something that can be explored and a lot can be learned for people that are biology majors, nursing majors, pre-med, physical therapy majors, community health workers, kinesiology majors, or just any student. It doesn't matter if you're a business major or a computer science major. If you're interested in learning more about how to take care of your own physical and mental health, this is also a really good opportunity for you. So the other part of the mind-body connection is not just how these systems are related, but also how your own behavior is at the central uh, place of those connections, meaning that health behaviors like your nutrition or diet, your exercise or lack thereof, or just general physical activity, your sleep and sleep habits, your stress and stress management, your relationships, how you seek healthcare, and then any complementary alternative medicine that you may already be engaging in, or perhaps there may be some that you don't know about and that you're interested in learning more about. So all of these different health behaviors are really important for us to be able to explore our own mental and physical health, but also how they relate to chronic physical conditions. So things that can develop later in life, they usually don't develop earlier in life, but things are changing, especially post-COVID. Younger and younger people are getting sick all the time. So it's really important for us to learn how to take care of ourselves. And if you're interested in healthcare, learning about who may be your future patients and the struggles that they may be encountering. So things that we've talked about can relate to diabetes and obesity, chronic obstructive pulmonary disease or COPD, which is usually something that people that have chronic asthma or that smoke for a large portion of their life can develop, sexually transmitted diseases, substance abuse and use, cancers, and cardiovascular disease. All these different chronic illnesses can result of poor health behavior. So learning how to take better care of ourselves is really important. We'll be having two different projects. So one of them is going to be about changing your own health behaviors. You won't be doing it alone. You'll be a part of a team. So we'll be encouraging each other along the way. And you'll be able to present whatever it is that you are able to change throughout the course at the end of the course. The second project will be on data collection. So not only are you interested in learning about your own physical health and mental health, which you can cultivate through that health behavior change project, but you need to learn about your context. So the family that you're a part of and the community that you're a part of. So in terms of the community aspect, the data collection project will be asking students to collect data from friends and family and other students around campus through posting the URL or the website where they can take the survey. And we'll gather all of that data. It will not be identified, so you won't be looking at your friends and family's answers, but you'll be looking at the general statistics and relating that information back to what we learned in the textbook and also peer-reviewed journal articles for your own research project that you can present at the end of the class for everybody to learn from. So this is supposed to be a really collaborative opportunity. That's part of the reason why we're offering it both online and in the classroom. For the classroom, we really want to have opportunities for us to learn from each other about how to eat. So bringing food, sharing recipes. Also, we'll have some field trip opportunities where we can go on hikes or perhaps other physical activity, depending on what our group is interested in and able to engage in. And of course the in-class activities and lectures that we'll be doing so that you can actually really see those connections between these different facets of physical and mental health. We strongly encourage you to apply. We really would like to have you in our class. Really looking forward to it. If there are any questions that you have about anything that I have not addressed in this video, please feel free to reach out to me. My email address is kshramek, so KSRAMEK @alamo.edu, and I will be on the lookout for any messages from you. I look forward to hearing from you and or seeing you in the classroom next spring. So happy holidays and take care. Bye.